Okay, hello, hi. So good afternoon to you all. I'd like to welcome all our participants today to this webinar. So we're going to record this and it's going to be available on our website and also on the social media platforms. So my name is Danny Diaper. I'm the head of the Science and the Medicine Pathway at the University Foundation Programme in London. So we've got over 30 years experience of sending students from our University Foundation Programme to a large number of high-ranking universities, including the School of Pharmacy at the University College London. So before I hand over to the School of Pharmacy, I'd like to show you a brief video which tells you a bit more information about studying at the University Foundation Programme. Great. So I'm delighted to say that we've got Professor Michael Munday with us here today from the School of Pharmacy at University College London. So he's going to lead this webinar. And if you've got any questions throughout the webinar, then please type them into the chat box and I'll keep an eye on that. And we'll deal with the questions. We'll have a Q&A session at the end of the presentation. So Professor Munday, over to you.
Thank you very much indeed, Danny. So welcome, folks, to this webinar. I'm Professor Mike Munday. I'm the Vice Dean for Education at the Faculty of Life Sciences at UCL. And the Faculty of Life Sciences is where the UCL School of Pharmacy lives. And I'm also Deputy Director at UCL School of Pharmacy. I'm one of the external examiners of the UFEP program for biology and chemistry. And so we've been accepting students from the UFP program for a number of years into the pharmacy program at UCL. And so that's what I'm just going to talk to you about now, the pharmacy degree, careers and what the degree looks like itself, with a little bit of information about the School of Pharmacy as well. And as Danny says, if you have questions, please post them in the chat and I will try and answer them for you. So let me share my screen. And hopefully we'll get a view. Okay. And so let's say a few words about pharmacy careers and the pharmacy degree. So what is a pharmacist? If you're thinking about pharmacy, then many of us will realize that a pharmacist is a health professional who practices the science of medicines. And I'll probably say the science of medicines a few times in the next 20 minutes. But this pharmacist takes a request for medicines in the form of a medical prescription, makes sure that it's appropriate, dispenses the medication to the patient, and then advises that patient on how to use it properly and whether they might experience any adverse effects or side effects. So the pharmacist is some intermediate between the physician and the patient who monitors medicine usage, makes sure that it's used safely and effectively. And I guess many of us would understand that, and that would be the kind of definition that many people in the street would give you. But there is many roles for pharmacists, and the pharmacists have advanced into prescribing medication these days and providing public health advice, primary health screening as well. Pharmacists have a role in general medical practice. And so the pharmacist really is this critical source of medicine's knowledge. You can find them in the high street, in community pharmacies, maybe the first places you would go for some advice, but you'll find them in healthcare teams within hospitals, in clinics, in GP surgeries now. Maybe also pursuing the science in medical laboratories and the pharma industry, discovering new drugs and medicines as well. The pharmacist is that accessible professional which really has this knowledge of medicines, but also understands the application of the science of those medicines to the clinical surroundings, to what it means to a patient. So why is the pharmacy career so exciting? Well, because pharmacists are going to make sure patients are getting the right medicines. They're going to counsel the patients. They're going to diagnose, prescribe, interact with other fellow professionals as well. They might be developing healthcare policy. They're definitely probably going to specialize in different clinical areas. Some may even be doing the science of drug discovery. And so when I'm asked frequently, what's the difference between pharmacy and pharmacology, I think it is the patient interaction. Pharmacology is the pure science of how drugs act, and pharmacists have to know that science. But pharmacy has that extra clinical perception of what these drugs do to patients, and what the patients do to drugs as well, how they'll metabolize them. Healthcare is a global issue, never been more so than the recent pandemic that we're now all within. And so understanding global health and what that means to different countries, fighting counterfeit medicines, seeing how things get approved in different countries around the world. We're all talking about that with vaccines at the moment, and making sure those medicines reach the markets and are safe and effective when they get there is all part of a pharmacist's role. I pick these guys out because, again, while we often think of community pharmacy and hospital pharmacy, GP surgery and industrial pharmacy, the pharmacy degree is a launch pad for many other careers as well. And so the 6 people you see on this slide here, I've taught some time or other over the last many years. And it's interesting to see where these guys have gone. So Priyanka at the top here is a pharmacist QP, and QP stands for qualified person. And qualified person means the person that actually ensures that drugs are of the right quality and of sufficient quality before they start testing them on patients in clinical trials. Becky is actually a clinical trial coordinator, so she's a pharmacist, but she works in particularly in oncology clinical trials at the Royal Marsden Hospital, although I think she's now transferred up to UCH, but in a similar role as well. She's using her expertise to run those clinical trials. Oksana here on the right worked for World Health in public health. And if you've been watching many news programs recently on the COVID situation, you may well have seen Oksana performing in various news programs as well, bringing that expertise from public health now to bear on the current situation. But she's a senior teaching fellow at UCL, has come back into education to share that knowledge. Over this side, Kira always wanted to work in industry. She's a medical manager at Roche Pharmaceuticals, so in pharma industry. Pervez here is a managing director of a very famous consultancy company called Accenture Consulting. So again, he consults for all of their pharmaceutical interest. And Usha has her own financial consultancy within the city called Findia Partners Limited, and they advise investors on where they might invest their money, what companies have new drugs coming through and new technologies. So here's 6 guys who've all done something a little bit different, not those standard pharmacy careers that we may expect here on the left-hand side, but just shows the wide, diverse array of careers that are available to pharmacy graduates. So I'm going to talk a little bit about UCL School of Pharmacy, and here's the school here in the top right-hand corner. And it's situated here in Brunswick Square, right in the heart of what's known as the Bloomsbury campus. The Bloomsbury campus is that part of London which is occupied predominantly by UCL, but by lots of different academic activities. There are some other members of the University of London in this area here as well, not just UCL. The School of Oriental African Studies is here, Birkbeck College is here, Royal Veterinary College is just up this road here as well. But all over this area, School of Pharmacy, what about 10 minutes away from the main campus, which is behind me here in the background. This area has lots of individual different parts of UCL, as well as the School of Pharmacy. Here's Great Ormond Street, the Institute of Child Health, and attached to the main hospital. Here's the National Hospital in Queen's Square, and the Institute of Psychiatry there, the Institute of Neurology is there as well. Across the road here, we have UCL Institute of Education. Here we have the Medical School and University College Hospital. So all over this area, every second building is some part of UCL. And if you're looking for that area within a London tourist map, then that is the Bloomsbury campus there. So you can see it's right in the heart of London, very close to all the major tourist attractions, which are shown here in relief. So right beside there, here's Buckingham Palace, and there's Oxford Street, Trafalgar Square. So UCL campus occupies this position right in the heart of London. Why is UCL School of Pharmacy so special? Well, it's the oldest school of pharmacy, established in 1842. It was the first school of pharmacy. And through its time, it's been an independent member of the University of London, and then merged with UCL in 2012. But through all that time, it's always been a specialist school dedicated to teaching and research in pharmacy and the pharmaceutical sciences. Pharmacy is our only undergraduate degree. All of our teaching is dedicated to the study of pharmacy. It was ranked 5th in the world for pharmacy and pharmacology in the 2020 rankings last year. So the guys that teach here know what they're about. It was originally situated here in Bloomsbury Square in the old building, but it moved to that Brunswick Square building I showed you on the last map about 1960. And the importance of being in UCL is that UCL is equally old as well, in fact, slightly older. Founded in 1826, it's ranked 8th in the QS World Rankings as well. And what many don't know is 2/3 of all that UCL does is biomedical sciences. So it's the heart of some academic health science center, which includes the Francis Crick Center. It's one of Europe's largest biomedical clusters. As well, good for research, good for teaching. He's got multiple Nobel Prize winners. The last one here, John O'Keefe, won the Nobel Prize for working out how the brain has its own sat-nav and how we're all spatially aware of where we are. And John is frequently on campus. You'd bump into him if you walked across UCL campus, and he's glad to talk to people, glad to have selfies as well. So if you should bump into John O'Keefe, don't forget to stop and chat. UCL has got associations with major hospitals like UCH, Great Ormond Street, Royal Free Hospital, Moorfields, the Whittington as well. It's got excellent student facilities and health and welfare advice. So the School of Pharmacy, being an independent specialist school within UCL, benefits from everything that UCL has. What about the degree? So studying pharmacy in the UK, you'll need to study the 4-year full-time degree, which is an MPharm. It's an integrated master's program. The MPharm in the UK is accredited by the General Pharmaceutical Council. They're the regulatory body that check that it's got everything that needs to be a pharmacy degree. And once you graduate after 4 years, hopefully with first-class honours, or at least second-class honours, then if you want to be a pharmacist in the UK, you would do 1 year pre-registration training in community or hospital, or you could even take some of that time in industry as well. And at the end of that time, there's a national examination. And it's a qualifying exam set by the General Pharmaceutical Council. And that will then, when you pass that and the pass rate is high, particularly for students from UCL, then you'd be able to practice pharmacy within the UK. International students might not want to do that. International students may be intending to go back home to their own countries, and so they may go back and do that pre-registration training in their country of choice. So it's not compulsory, but if you wanted to practice in the UK, pre-registration is required. This is really the only way to qualify for practicing pharmacy in the UK. Most of the other routes have largely disappeared now. What about the degree itself? So pharmacists have got to maintain and improve health by the best use of medicines. So we think the degree has got to give an integrated and interdisciplinary view of the science of medicines and then put that into practice. So trying to explain what the integrated and interdisciplinary view of the science of medicines is, I'd like to use this slide, where you put a medicine at the center of the slide and see what is it you need to know about it. So this slide has got aspirin, acetyl salicylic acid at the center, and some of the science we need to know includes this strange subject area, pharmacognosy and phytotherapy, which is all about the fact that so many of these medicines originated in natural products. Aspirin, for example, came from the bark of the willow tree. But of course, we can't cut down all the willow trees in the world to get our aspirin, so we have to know some pharmaceutical chemistry. How do we synthesize this? What is the structure of the molecule? What's its properties? How would we always check and analyze that it is pure? And when we've got some pure aspirin, then we're going to test and see what does it do pharmacologically. So the pharmacology and physiology says that aspirin's an analgesic, relieves pain, it's antipyretic, reduces fever, it's anti-inflammatory, reduces inflammation, and it's antiplatelet, so it stops blood clotting. But if we wanted those effects in a patient, we wouldn't just take aspirin as a white powder. The patient would be expecting a medicine. And so a strange form of medicine is this, of chemistry is this, the pharmaceutics and formulation of medicines, the preparation of medicines, how we take that compound in the middle there, aspirin, and formulate it into maybe a pill or a tablet. Or maybe it's something which dissolves in a liquid with a fizz, or maybe it's a syrup, or maybe it's in an ointment that you have to rub on. Maybe you inhale the medicine, maybe you inject the medicine. Formulation is all about turning that drug into a medicine that the patient is going to expect to receive from the pharmacist. And when you give it to the patient, the question is, well, does it get into the bloodstream, and how does it get into the bloodstream, and does it achieve significant concentrations? So pharmacokinetics and drug delivery is all about that. What can we do in this formulation to make it delivered more effectively in the body, and how can we achieve the concentrations in the blood to get a pharmacological action? That brings us then to the mechanism of action. The biochemistry says, what does the drug target? Is it going to target a receptor or an enzyme? Aspirin actually targets an enzyme. It's an enzyme inhibitor. But what is that mechanism of action, and how will it be metabolized in the liver as well? What will the metabolites be that are produced? Will we see side effects from these? When we know all that science, we can decide what will we use it for. So therapeutics is that. What can it be used for against what clinical conditions? What side effects should we look out for? Does it interact with other drugs? What dose must we give patients to achieve the concentrations that are going to have the clinical effect? And when you have all of that integrated scientific knowledge, then you can put it into practice. So what must a pharmacy advise on? What are the preparations and uses? What are the guidelines from the National Institute of Clinical Excellence, which says whether it can or cannot be used, whether it's okay in the UK? Is it an over-the-counter medicine, or is it a prescription-only medicine? Is it a drug which is likely to be abused? Is it a drug which could be taken by children, pregnant women? Are there restrictions on its use? So understanding the law and ethics and the practice of the pharmacy profession would use all of that scientific knowledge. The program at UCL School of Pharmacy looks like this. There are the 4 years. Going from 1 at the bottom up 4, and there are 4 modules per year, and these are color coded here to show us what's going on. And so yeah, in yellow here is that professional practice. So understanding prescriptions and dispensing medications, interacting with patients and other healthcare professionals, particularly medics, communicating the science and practice, understanding WHO initiatives and clinical therapeutic frameworks, etc. is all within these modules, which includes placements as well, going out and getting experience with hospital placements, community pharmacy placements in doctors and GP surgeries as well. The sciences here, biology is color-coded green, so understanding how cells and tissues and organs function, and then understanding what goes wrong in disease in particular states, whether it's cardiovascular and renal, whether it's immunology and inflammation, whether it's central nervous system or the GI tract or liver. The biology, which is biochemistry and pharmacology, human biology shown in green, and then the chemistry and formulation in blue and red here. So understanding the structure of the drugs and how they're made into safe and effective medicines, how the drug industry, pharma industry discovers drugs, and some of the new future technologies. So many of the new drugs now are biological molecules, monoclonal antibodies, vaccines, again, being very topical. And so some of the new technology is explored in this module. Some modules have got all the colors in. I'm going to come back in a moment to explain to you what that actually means. But how do you learn? Well, lectures, practicals, skills classes, tutorials, workshops, seminars, e-learning, research project. There are lots of different ways, including the placements out there in the real world of pharmacy that are part of the education process. I'm going to pick out just a couple. Workshops are one. The integrated therapeutic workshops feature throughout the program, and here students come together in groups. They each get given an iPad, so they have access to the internet, and they're going to work through case studies to understand what are the various components. Working through the case study is what this group's doing here on asthma. And so understanding what asthma is, the difficulty in breathing, understanding the drug which is used to treat that, salbutamol, what its structure is, understanding how its mechanism of action, which is to work on receptors to cause smooth muscle relaxation and open the airways, understanding how you formulate that. Salbutamol is formulated as an aerosol, and that aerosol is given in an inhaler. And so teaching the patient how to use an inhaler to get that salbutamol into the lungs to cure their symptoms they're seeing from asthma is all part of that case study that the students will run through. Practical laboratory classes are equally important, so students will synthesize some drugs, they'll look at the mechanism of drug action and test some drugs on some real cells and tissues, and they'll make some medicines. We have tablet making machines, and we have capsulating machines as well, so you'll see that process of formulation. Throughout then, there is the importance of those professional modules, so the pharmacy practice and clinical pharmacy. We have a clinical skills suite here where students will learn the art of dispensing and understanding prescriptions. We have our own drugs here in the cabinets on the wall, so students will get familiar with handling and dispensing and advising patients on drugs. We can bring professional patients into these scenarios so they get experience, because that then prepares them for going out there in placements in hospitals and community, where they'll interact with real patients, take real patients' records, look for where pharmacists have made an intervention, look and see the role of the community pharmacist in dispensing medications and advice to guys coming in off the street. We have a student dispensary here at Greenlight Pharmacy, close to Euston Station, and this is in the basement. And so these students by video link can see what's going on upstairs, and they all go upstairs and join in as well with some of those activities. So the experiential learning is very important. There are placements that run throughout the program. This reminds me to talk about these modules. There's also points where students get to make some choice. So again, the research project at the end of the year here, this one in year 3, is where students get to choose some specialist modules that they want to study. So we hope by then, as you move through to the later stages of the course, students will have an interest perhaps in clinical trials or anti-cancer medications, maybe from drugs from natural products, but maybe drug delivery across biological barriers, or neurodegeneration and the treatment for neurodegenerative disorders. Medicines for children, pediatric pharmacy. There are a whole range of different modules in there where students will be able to select 2 of those in year 3 so they can study some areas of pharmacy in more detail. And then in year 4, half of year 4 is dedicated to the student's own individual research project. That could be laboratory-based, it could be hospital-based, looking at clinical data in a hospital setting. It is possible to get a placement in industry as well for those interested in the pharma industry. And it is also possible to carry out this project somewhere else in the world. So we have the opportunity to go extramurally to international placements with our partners around the world. We've got 29 partners in Europe, 7 international partners in countries like the United States and Australia and China and India. And so these are 3-month research projects in one of these partner universities. It's not just the best 4 students that go either. We encourage everybody who's performing at that second class honours standard at the upper region to try and take part. And we had 36 students in 2017-18. We had 42 the next year in 18-19. It's been more difficult this year for obvious reasons. But these students go and get real experience of working in different situations and different cultures around the world. There is life beyond the lecture theatre as well. We think it's important that our students have a rounded experience. So we encourage students to get involved in extracurricular activities. It's not just about study. So there's a very active students' union at UCL with many clubs, societies, whether it's politics or sport or journalism or entrepreneurship. There's something at UCL for you. We encourage volunteering as well. Many of our students get involved in volunteers activity as well. There's theatre, there is sport. These guys down here at the bottom are part of the UCL School of Pharmacy Fight the Fakes campaign, which uses social media to raise awareness about counterfeit medicines. And they're there at conference in Brussels, is what this photograph shows, where they actually presented some of their work trying to use social media channels to promote counterfeit medicine. What are we looking for? So we need people that are responsible, dedicated, enthusiastic, and hardworking, who love the science, but are interested in that clinical side, the context of patient care as well. Because the pharmacy degree, as I've said before, is an integration of science and practice. And we encourage you, again, to think about all the other things that you can do at university, get involved in citizenship activities. How do we select the applicants? Obviously, the qualifications are important, whether they're A-levels or your performance in the UFP program. A personal statement that you write that would explain why you're interested in pharmacy, a reference as well. And then this, a values-based test and a values-based interview. So you will be asked to fill in an online quiz, really, and test, which has really got some situational judgments, a short bit of writing on a piece, an issue of medical interest, because it is so important, and it's actually absolute requirement that if you're going into one of these vocational healthcare professions, that you can demonstrate that you're going to be safe and effective when it comes to patient care, that you're going to be caring and compassionate, honest and respectful, and responsible and accountable for your actions. So there is these values-based tests, and it's not a major stumbling point for any students, but they will just be gauging and maybe making you aware that it is important, because a patient is going to expect these values within the pharmacist that's dealing with their therapy. So that is an overview of the pharmacy degree, so pharmacy careers, and UCL School of Pharmacy. If you have questions, please do ask some now, and I will try and answer them during this session. If you think of them at a later point, then feel free to email me. That's the email address there, michael.mundy@ucl.ac.uk. Or again, if you didn't want to speak to me, we have our Student and Academic Support Office, which is School of Pharmacy, so sop.saso@ucl.ac.uk. Again, anybody there would be happy to answer your questions. So I will stop sharing and gladly answer any questions anybody might have.
Lovely. So thank you ever so much for that presentation. So if you've got any questions that you'd like to ask, you can just open the chat box, type your question in there, and we'll deal with those as they pop up. So we've got some questions that we'd like to that have come in already that we'd like to ask. So you mentioned a couple of different teaching methods as part of the course. There were kind of lectures and workshops. Just wondering how much time is spent in lectures and how much time in workshops, for example. What's the kind of breakdown roughly?
Yeah, it does vary through the progress of the course. And so in year one, there's quite a lot of directed, some say didactic teaching, which would be sort of lectures and then practicals. It kind of works that on the whole, students would sort of have lectures in the morning, 2, 3, maybe even occasionally 4 hours, but that doesn't happen so often. And then a practical or skills class in the afternoon. I think every student probably gets about 3.5 days of contact time during that period. It may even be 4 days in some weeks. But as the and that's maintains into second years as well. So the formal teaching time and the workshops and skills classes and lab practicals are probably about 50-50 in terms of what proportion. But as they move up the years into the later years, then there is more reliance on self-directed learning. So students will have tasks to do and reports to write and investigation to carry out. The research project is a great example of that. That's a whole one half of the final year spent on the individual research. And so although there's obviously a supervisor that's going to advise with that, the student is going to be making their own way. And other activities that occur in those third and fourth years, there is an increasing number of hospital placements where there are exercises to carry out, but it's about going out there and interacting with patients and getting experience. There's another activity which we call advancing science into practice, which again, students work in groups and have to devise an actual service for pharmacy. So it might be, for example, advice on travel and tourist, the tourist side of pharmacy. It might be advising patients on mental health issues. And so students make videos, they go out to survey patients to see what's out there and what needs, where there might be holes in service provision in pharmacy as well. And so that is a much kind of less formal mode of teaching. So it does vary. There's going to be more responsibility for learning as you progress into years 3 and 4. But the practical skills versus didactic learning, probably about 50-50. So.
Okay, good. Sounds like there's a good variety in teaching methods there. So we've had another question come in about English requirements. So is it possible to do the foundation pharmacy with grade 3 GCSE English? So so what's your English requirements for access onto the pharmacy course?
So the GCSE requirement, I'm going to refer you to the website to be absolutely sure, but I was pretty sure it was grade Bs that are required in English and mathematics at GCSE level. So, but it's worth that's definitely an important point to check. While the A-levels must contain chemistry plus another science, which could include maths as well. So, and then a third A-level of your choice. And the A-level grade offer for pharmacy at UCL is likely to be AAB. But there is a GCSE requirement as well. It's in English language and mathematics, and I'm pretty sure they are grade Bs. But that is just definitely worth checking.
Okay, so for the A-level translation to the UFP, the grades that you accept, they would have to take the biology major module, the chemistry major module, and another major module, and get those same grades. Is that right?
Yeah, that's absolutely right. Sorry, I didn't make that clear. But for the UFP program, again, in the 3 specialist areas, chemistry is a requirement. Biology actually isn't, although I often think it should be. But it's usually what students choose to study as well. And I would absolutely recommend that, because I think biology is increasingly important to understanding pharmacy. So it's chemistry and one other science. But again, it's equivalent to the A-level grades. So the UFP grades required will be AAB in the 3 major modules.
And as part of the University Foundation Programme, we also help students achieve the necessary English qualifications that they would need. So we have the IELTS course that we give lessons and help them achieve the grades that they need then to access your pharmacy course.
Yeah.
So another question has come in about the pharmacy programme. Do you offer anything with a 1-year industry experience?
The pharmacy degree is quite regulated in the UK, and so the General Pharmaceutical Council are very strict and quite demanding on what is in the various years of the course before they would therefore accredit the degree, because again it's leading eventually into a professional qualification. So it varies from School of Pharmacy to School of Pharmacy when you look around, but in most of them the best chance you have within the pharmacy degree is probably a 2-3 month project, and that is really kind of what I described there a moment ago. At UCL there is this 12-week research project. It's in the first half of year 4. It is individual, so there's an opportunity there to get out into industry and spend 3 months in industry. But I don't know of a pharmacy degree in the UK which has a kind of the year out of the sandwich course structure. They tend to be with the science-based degrees. So for example, pharmacology at UCL does have that opportunity of doing a year in industry. But because the pharmacy degree has this professional qualification at the end, the regulator that does not allow you to step out effectively and do something else for a year.
Okay, lovely, thank you. So we've got 2 more questions come in. Do you have time to answer those? Is that okay? Okay, good. So somebody's asked about post-study work. So will they get 2 years post-study work after completing the MPharm with you?
Yeah, so that's a very, very interesting point. So a number of schools of pharmacy, and UCL have just done this year before last, they designed a 5-year pharmacy degree where the pre-registration training was actually part of the degree. So it's kind of the 4-year degree plus a year of pre-registration training with our own special partners out there in communities and hospitals. And this was because some international students find it more difficult to get visas to actually get in pre-registration training in the UK. And so this is one way of guaranteeing it. In the 5-year degrees, the difficulty is that you don't get paid then for that 5th year, whereas normally the pre-registration training is a salaried position. In the 5-year degrees, it is not a salaried position, but it does at least guarantee that you get that pre-registration training in the UK and could become qualified. Now, one of the reasons for so many schools of pharmacy adopting this method was because the United Kingdom back in 2012 had removed the guaranteed post-study work visa. So international students used to be guaranteed 2 years of training or employment, visa employment, when they completed a science-based degree. It was our old friend Theresa May who took that away, and I've held it against her ever since. But interestingly, Boris Johnson has brought those back, and so they are back in they're back in use again in this coming academic year. So interestingly, yes, for anybody who's thinking of studying pharmacy now, who's an international student, they should by rights, and I understand it's completely true, have a guaranteed 2-year work visa at the end of the pharmacy degree, which means they will be able to go and get pre-registration training without the visa difficulties that we've had for the past 8 or 9 years.
Great, that sounds like it should make things a bit easier then for the onward steps. So there's a question again, another one about qualifications. So would you accept things like BTEC Extended Diploma Level 3 for the course?
It is worth inquiring. Again, off the top of my head, I can't say yay or nay, but there are non-standard entries. So like so many other schools of pharmacy, A-levels is what the admissions group kind of recognize. But I've always campaigned over the years that we should take non-standard entry, which includes foundation programs and foundation degrees. BTEC is probably more difficult. It might be but again, it will depend on the level of qualification there. There is a list on the website that lists some of those, but I would suggest that you email me or our student services, because then if they can have a close look at what it is that's actually been studied, then they can see if it matches. So I know not every foundation program is acceptable. That reflects levels of science within some of the foundation programs. But UFP is absolutely acceptable. We made sure of that over the years. But again, it's worth inquiring. And if you've got a syllabus and you can say, or you've got a transcript and you can say what it is that you've studied, it is worth emailing me or the student services first, just to check.
So yeah, you're saying that you do accept kind of the non-standard qualifications. So the UFP program that we run is recognized as an A-level equivalent. So obviously, like you're saying, you check the standard of science that goes on in teaching. So somebody's got a question related to that. So if they took the UFP course and got the necessary grades, but had done badly in their A-levels or their IB, would that affect their chances of getting accepted? So they've done badly in their A-levels and IB, but come onto the UFP and got the necessary grades. Would those previous poor grades affect their chances?
No, absolutely not. And there are students who have been in that situation where, for sometimes very often no fault of their own, they've had a poor performance in A-level, and I and others at UCL have sort of actively recommended that they do the 1 year UFP and kind of rescue those results. So UCL will only consider the best result, if you like, and so it won't be looking at past A-level performance. It would be judging on performance in the UFP.
Lovely. Okay. Well, that's great. I think that's all of the questions there covered. Lovely. So I'd just like to thank you very much, Professor Monday, for joining us, and all the participants as well. If you would like to visit any of our other webinars, we've got a webinar event page that you can go to. I think that might be pasted into the chat box now. If you've got any questions for the UFP team, the University Foundation Programme team, you can email us at admissions@ufp.uk.com. And that also hopefully will be pasted into the chat box now. There we go. All right, so you can click on those links if you want access to the webinar page. So we've got another, I think, about 15 or so more webinars coming up over the coming weeks. Lovely. Thank you everyone for that session today.
Thank you very much. Pleasure.